Life moves fast, and so should the answers to your biggest questions. Welcome to Endo Batteries Quick Connect, your direct line to expert insights. Short, powerful, and right to the point. You send in the questions, I bring in the experts, and in just 5 minutes, you get the knowledge you need. No long episodes, no extra time needed. And just remember, expert opinions shared here are for general information and not for personalized medical advice. Always consult your provider for your case-specific guidance. Got a question? Send it in, and let's quickly get you the answers. I'm your host, Alana, and it's time to connect. Today, I'm excited to welcome Dr. Melissa McHale, a gynecologic surgeon specializing in minimally invasive endometriosis surgery. Known for her compassion, patient-centered care, Dr. McHale combines advanced surgical skills with dedication to truly listening, educating, and creating individualized treatment plans. A graduate of Boston University School of Medicine, she completed her residency at the Johns Hopkins University Hospital before training for 2 years with internationally recognized endometriosis specialist, Dr. Andrea Vidali. She's also highly skilled in dynamic ultrasound to map and diagnose endometriosis. Dr. McHale takes a multidisciplinary approach, often collaborating with specialists from other fields, and has a special interest in patients with conditions like hypermobility, POTS, and MCAS. Her mission is to improve early diagnosis, reduce delays in care, and help patients everywhere reclaim their quality of life. I'm thrilled for you to hear from her today. Let's get started. What do you think is the first step in trying to find a surgeon?
So the first step really is establish whether or not this person is qualified, right? And so, some of the things, it's like, do the background research on this person, right? Like, did they go to medical school, right? Like, yes, I'm sure they did if they're a surgeon, but like, where did they go? Where did they do residency? Did they do a fellowship? And then who taught them to do endometriosis surgery, right? Is this something that they learned in fellowship? Did they have a specific mentor? Did they learn it after fellowship? Like, really try to figure out, like, okay, if even most fellowship trained gynecologists in the US don't know how to do a complete excision of endometriosis surgery, how is it that this person knows how to do it, right? If they trained at the University of wherever for their fellowship, but you can't find anyone at the University of whatever who you would trust to do your surgery, okay, well then, if this is where that person trained and they taught them everything they know, is this person really qualified or not really, right? And sometimes someone got extra training after fellowship. They were mentored by somebody. These kinds of things, everyone has a different journey, and it's not always necessarily about where they did fellowship, but figure it out. Don't be afraid to ask, like, when did this become your focus? Is this something you learned on your own? Did somebody teach you? Did somebody mentor you, right? Mm-hmm. If you wouldn't let their mentor operate on you, consider whether or not they should operate on you, right? Like, and some of it's about personality, but a lot of it's about skill, right? And so really look into where they learned to do that stuff.
Right. Well, and I think that's something that is hard because as a patient, we don't always know who's credible and who's not. How do we decipher that as a patient if we don't really, like you and I, we're kind of in this endo community pretty thick into it, so we know who's really good. We know who's credible. But for people who don't know and they're just starting this journey, how would you go about figuring out if someone is credible or not?
So there's a few different things you can look at, right? There's all these different lists, right? People talk about lists on social media and those kinds of things of who is qualified, who believes in excision, all those kinds of things, right? You can look at the sort of reputation, both from patients, like what are their reviews, that kind of stuff, but also what do other doctors say about them, right? Because often, you can sort of tell what doctors associate with other people whose whole world is endometriosis, right? If somebody is spending all of their time with other people who totally focus on endometriosis, it's because they're like you and me. They feed off of constantly thinking about how to get, better at providing endometriosis care, right? If they're like totally on their own, nobody refers to them, they're not doing all of these things to forward their knowledge, then, that should give you pause.
That's a wrap for this Quick Connect. I hope today's insights helped you move forward with more clarity and confidence. Do you have more questions? Keep them coming. Send them in, and I'll bring you the expert answers. You can send them in by using the link in the top of the description of this podcast episode or by emailing contact@endobattery.com or visiting the endobattery.com contact page. Until next time, keep feeling empowered through knowledge.